Have you ever wondered what in the world a physical therapist could possibly offer you during your first stage of labor? My name's Nicole. I'm a physical therapist and a mama, and I specialize in helping mamas during pregnancy, labor and delivery, as well as in the postpartum recovery phase. And today I want to go through exactly what the first stage of labor is and how in the world a physical therapist could help you through it. When talking about the first stage of labor, this is when true labor begins, and it is finished or ends when you get to 10 centimeters or fully dilated. There are actually two parts to the first stage of labor. There's a latent phase and an active phase. When talking about the latent phase of labor, this is the beginning of the first stage of labor. It's when you're going from about 0 centimeters dilated to 6 centimeters dilated, and your cervix is also effacing. If you're wondering what the difference between dilating and effacing is, dilating is when the vaginal opening is getting bigger and bigger to make room for baby's head to exit, and then effacing actually has to do with the thickness of the cervix. So basically the cervix gets pulled back and back and back, and what was about this long and is the barrier between the outside world and baby's head up here, it starts to shrink and it gets to be about the thickness of a piece of paper. And that is going to make it much easier for baby to exit. Your contractions are maybe irregular, but probably irregular. They're not lasting that long, maybe like up to a minute, and they're probably about 5 minutes apart. If you're wondering what you're going to be experiencing as the mom during this phase, your contractions are certainly painful, but they're probably pretty manageable, and in between contractions you're able to talk or rest, and it really isn't requiring that much of your concentration. When you move into the active or the second phase of this first stage of labor, this is when you go from 6 centimeters dilated all the way to 10 centimeters dilated. During this phase, contractions are more intense for sure, and they're closer together, about 2 minutes apart at this point, and they're lasting a little bit longer, maybe like 60 to 90 seconds each. You might be having 2 contractions in a row even before you get that little break in contractions. During this phase, you're also going to go through what many women know already as transition phase. This is the phase where you go from 8 centimeters dilated to 10 centimeters dilated. And a lot of times women experience nausea, vomiting, they're easily annoyed or agitated, may even become angry. Our thoughts become a little bit irrational, and we might be thinking, there's no way I can do this, or I need an epidural, even though you really didn't want one. And so this is a hard phase to go through, but it's good news because it means you are so close to the second stage of labor, and this is when you're actually going to be delivering your baby. During this phase, baby is making its way through the birth canal and getting so close to that vaginal opening when you're going to be pushing and getting baby out. So now that you know what the first stage of labor is, and you're wondering, what the heck does a physical therapist have to do with any of that? I'm going to get to that now. So sometimes during your pre-labor visits, we go through some of these things, and sometimes a physical therapist actually accompanies you during your labor and delivery. And the things that we want to help with are creating a comfortable environment for you. Some moms really do like it quiet, they like it dark, and they want very little distractions. And some moms want a big crowd, they want all their family there cheering them on, they want loud music, really getting them pumped up for the occasion, and that's how they best cope. It doesn't matter what you're going to find comfortable, but we do know that the less stressed you are, the more your hormones are going to be able to do their thing and get you to progress through this first stage of labor more quickly, which is everybody's goal because we all want to see that little baby at the end. The other things that we help with are helping to advocate for you and your partner to help the staff and your visitors maintain that environment for you. We can keep your support person nourished and hydrated, and we can also give them pointers on how they can be most helpful to you. Perhaps it's most comfortable for you if they are quiet or maybe talking in your ear instead of right into your face. Maybe we can help create smells in the room that are going to be relaxing to you and getting rid of those smells that really annoy you. We also help your partner know and remember some of those comfort measures that are going to be helpful to you. Sometimes we use massage to make you comfortable. You can put pressure on your hips or pressure on your sacrum. We can help you change positions if you're having back labor to get off your back, or if you want to be on the toilet to labor because this helps your pelvic floor muscles relax better. whatever you can do to be comfortable, we try to use the tools that we have and the things that we've practiced to make you most comfortable. The other thing that we try to do is remind you that moving around and changing positions and being in upright positions as much as possible during this first stage is going to be really helpful in progressing labor. It's going to help you to dilate and efface more quickly. And that's what we want, because then you can move into the second stage of labor, and that's when that baby is actually going to be born. And then lastly, we just want to make sure that you remember all those tools that you've been putting in your toolbox to help you cope with the pain. Maybe you've been practicing your breathing to get through contractions, or you've been working on mindfulness to try to distract yourself from the pain. Or maybe you wanted to moan instead of yell during labor and delivery. We remind you of those things and help you to utilize them to have a very positive birth experience. The question I would love to have you answer in the comments below today is, what kind of birth environment do you imagine that you would be the most comfortable in? That quiet, dark room, or that loud room with a big crowd cheering you on? Thanks so much for joining me this week. I would love to have you subscribe to my channel so that you can more easily find my videos. Give me a big thumbs up if you liked today's video, and we'll see you all next week.